Hey there, YouTube family, and welcome to another Kevin Strong show. Everybody's heard about it. Brian Thompson, the CEO of United Healthcare, was gunned down in New York a couple of days ago. Big story. There were some clues that was left at the scene, casings with words on them. What do they mean? Is this the tip of the iceberg? Are people getting so fed up with the system and the aristocrats that we're starting to become a vigilante society? So we're going to talk about that briefly, talk about some stunning things that are going on within the healthcare system, and you need to take care of yourself because the best health insurance is preventive maintenance. If you're new to the show, welcome. Let me start off by saying welcome. Hit the bell notification, subscribe, like, and comment. Without further ado, we're going to slide over here and get into this article, and we're going to talk about it a little bit in detail. But the first thing I like to bring to your attention is talking about some things about United Healthcare as an entity. It's my understanding that they probably deny more claims than probably any other insurance company, like 3 times as much. So who knows what the motive was behind this planned killing? It's very sad. Despite this man's checkered past, nobody deserves to go out like that. Some other statistics you might want to be aware of before I kind of get into the article, specifically talking about who was Brian Thompson, is that these are things that are denied initially from a percentage standpoint in aggregate in terms of the healthcare system. What I mean is that you come up with a claim, and what percentage initially is denied. When it comes to private pays, 15% of most initial claims are denied. Medicare Advantage, almost 16% of the initial claim is denied. Okay, these are the elderly and most vulnerable of our society who probably don't have the time, the physical health, or the financial resources to fight some of this stuff. Commercial claims, 14%. Medicaid claims, 17%. Medicare claims, 8.4%. And the beat goes on. So there was a recent report from a consulting company that kind of highlighted some other things. Hospitals and healthcare systems spend, you ready for this, ladies and gentlemen, almost $20 billion in 2022 trying to overturn denied claims. The system is set up not to take care of you. This is why your health is the most paramount concern you should have, regardless of your age. Not money, not status, your health. Denied claims tended to be more prevalent for higher cost treatments, with the average denial pegged to charge of $14,000 or more. So the higher the treatment and the expense that's associated with that, they're more likely to deny that claim, which probably means if it's a high cost treatment, it's probably something that you need. I've also talked about there's a couple components that deal with healthcare that a lot of people don't understand. It's not just about your damn premium, ladies and gentlemen. Please listen to me. It's not just about your monthly premium. You need affordable health care, and you need access to affordable health care. Why are so many Americans getting fixated on how much it costs for health care, only to find out that when they need a specialist, there's a 3 to 6 months waiting list before you can see that doctor? In between that period, who knows what type of illness or sickness that's manifesting itself, to the point that when you finally do see the specialist, they say, oh, I'm sorry, now it's stage 2. But if we would have caught it 6 months ago, we would have had some treatment that we could have used to intervene to either mitigate or totally eradicate that illness. It's just not set up to be efficient. You need quality and affordability and access to good health care. Nearly 15% of all claims submitted to private payers initially are declined. I said that, including many that were pre-approved during the prior authorization process. So your initial claim, or your doctor says, yeah, based on your insurance, you're good to go. You have the procedure done, then all of a sudden now you have to fight with the insurance company because they don't want to honor it. Overall, 15.7 like I said about Medicare. This is just really, really a sad situation. So what happens? Claims that it gets denied have serious consequences for the patient, right? Paying the entire cost of the treatment, turning bills into medical debt. Contrary to popular belief, the majority of people who file bankruptcy is because of medical related debt. It is not credit cards. Hesitant to seek healthcare in the future because you don't know if you're going to have to go through this vicious doom loop all over again and fight the insurance company to pay for something that allegedly you're supposed to be covered for. And finally, cutting costs on food and other necessities. And as I said earlier, this hits the elderly really, really hard. So a lot of people were wondering, was this a planned hit? I think this guy made $10 million a year, something like that. We're going to slide down here to the article and basically talk about who was Brian Thompson. He was the executive, companies based in Minneapolis. You can kind of see this here. This is kind of something about his bio. He spent more than 20 years raising through the ranks at United Healthcare, which offers insurance to companies and individuals, employs over 140,000 people, and had $281 billion in revenue in 2023. He received total compensation of $10.2 million last year, with a $1 million in base pay augmented by substantial cash and stock grants. The company profits rose on his watch, jumping to more than $16 billion last year from $12 billion in 2021. So big increase, a 30% increase from 2021 to 2022. And that's how he's heavily compensated. I'm not an expert in this field, but I'm pretty reasonable in saying that how do they make so much money? Probably by denying claims. I think that is a fair statement. This guy lived in Minneapolis. It's just a really sad story. Don't know how it's going to end in the long run. I guess the investigation is still pending. Deny, defend, all those things that was written on the casing that was left at the scene kind of makes it sound like you're forgetting humanity. And who knows what the real message is. Maybe we'll find that out in greater detail, but wanted to spend some time talking about this particular topic and issue because I think so many people get misguided, because I have people that I work with during the day that, we've got this new healthcare plan because we're switching over that's going to allow for retired medical insurance. And some of those guys haven't did a sit-up, since Johnny Carson was on TV back in the goddamn 80s. But people are so fixated on it. I need this healthcare. No, you need to take care of yourself, because you don't know if you get sick, if you're going to get access to that specialist to help you out. This is why I'm a component, whether it be 3, 4, 5 years down the line when I ever decide to retire. I'm highly entertaining the fact of moving overseas, because the healthcare is more affordable. You have access to quality healthcare. I even know this lady that talks about there's some type of insurance you can get in Panama for cancer. The name of this lady's channel is called Panama Relocation Tours. Her name is Jackie Lane. Looks pretty good too to be 70 years old. She's holding it down quite well. But anyway, I say that to say, she says just to get a preventive maintenance insurance for cancer, not that you have cancer, but in the event that you do get cancer, you're covered up to like 70 or 80%. Sit down, relax. $63, not a week, not a month, per year. Look it up. Jackie Lane, Panama Relocation Centers. One of the people that she helped relocate to Panama said that her husband, it was a guest on her show, her husband had died tragically, obviously, of cancer in Panama, and had 7 days of extensive chemo treatment, and the total bill was $723 for a week. He was in the hospital 24/7 for 7 days, undergoing extensive chemotherapy treatment, and the medical bill for that week was $723. So I'm not advocating that everybody needs to look at this as an option, but if you're going to stay in the U.S. long term, you've got to factor in, once again, not to sound like a deadbeat, is this affordable, and what kind of quality healthcare do you get for that money, and do you have access to a specialist? Our system is broken. So the fact that you don't have access to a specialist when you need it in a timely, speedy, and fashion is probably more incumbent upon you to spark a sense of urgency to say, I need to be very proactive when it comes to my health because I don't want to be in that system, or I want to delay my health problems for as long as possible. So that's going to do it. I hope you enjoyed this edition of the Kevin Strong Show. If you're new to the show and you are enjoying my content, hit the like button, hit the bell notification. Have a great weekend, and I'll see you guys in the next one. Take care.